Okay, we're going to start. Everyone, good morning. We're not going to wait for some of the facilities if they are not yet in due to time constraints. Now, we sent you this invite yesterday, and you can see the first slide. This pertains to the emergency temporary standard. I'm pretty sure that you are familiar with the word ETS, but perhaps you don't know what ETS stands for. So ETS stands for Emergency Temporary Standard. Now, this particular standard was issued by the Department of Industrial Relations, and a division thereof is the OSHA. OSHA is not a standalone agency, but a department within the Department of Industrial Relations. This is a state department or state agency. So they issued the ETS in response to the COVID-19. But this standard is simply an emergency measure. In other words, if the pandemic or the public health emergency has been lifted by the state of California or by the national government, then this ETS ipso facto or in of itself will be terminated. So this is simply temporary. Now, since this has been in force and in effect last November, and therefore I have to, part of our task in risk management is to share this with you. Why? Because OSHA, if there is one agency or OSHA in the state of the nation that is very overzealous in implementing the ETS or any of the relevant regulations of OSHA, it is the California OSHA. There are 22 state-approved plans out of the 50 states. In other words, on top of the federal OSHA regulations, the 22 states came up with their own approved plan. And which will prevail? Of course, the state law will prevail. So this is very important then for you to have a good understanding what this ETS stands for. Now, I'm not only going to cover the ETS. I will also cover two of the laws that is relevant, extremely relevant to the ETS. This pertains to the reporting requirements, the benefits that has to be given to employees, and including the implementation of the COVID-19 prevention plan or prevention program, in short, CPP, and as well as the injury and illness prevention program. These two programs fall under the ambit of OSHA, and it is very important that you have to implement it, which I'm going to share it with you. Why? Because we have two client facilities that has been or was or were the subject of a OSHA inspection by the Certified Health and Safety Officer. They call themselves CHSO. Now, it triggers on three circumstances. One, if we are going to report injury or illness to OSHA. Second, if an employee anonymously will call OSHA as a result of a perception could be one, or objectively, that the employer is not observing safety in the workplace. In other words, the employer is not providing all the mechanisms, the policies and procedures to ensure the safety of its employees. They can call anonymously. Number three, OSHA, if it deems that your facility, based on reports that you have of confirmed cases, is extremely high or above the county tier numbers or in the community, even without telling you, they will just come into your facility. If they will, and of course, they're going to ask you all of these procedures, including the ETS. That's why we have to be proactive. And almost all that we reported to OSHA, they issued us a citation and notification of penalty. So notification of penalty that comes with the citation is money. We have to pay. And I will tell you, without mentioning the names of the facility, we have settled as a result of an informal dispute resolution, which is one of the avenues that we can use to settle the citation 13,000. 13,000, I guess, yes. And the other one, we paid 3,500. And more is forthcoming. And we don't want this to happen in your facility. So that's why this presentation is very important. In addition thereto, I will not only discuss with you the ETS, I will also share with you certain situations regarding human resource. What if an employee refuses to get vaccinated? What if an employee refuses to come to work? What if an employee file a fraudulent claim with EDD that he has COVID when in fact he has no COVID? What if an employee has medical and religious reasons? What are you going to do? How about confidentiality as to their medical information, as to the refusal to take vaccination? Is this privileged and confidential? Can you discuss this among your co-workers? Can you divulge this? And I will also include how to protect yourselves from foreseeable litigation claims relating to COVID. Once the pandemic will end, I'll tell you, we have already projected, based on our informal conversation with our lawyers and even our insurance broker and insurance companies, that we secured insurance coverage. There will be massive lawsuit, not only in the area of professional liability as it relates to residents that died perhaps as a result of the COVID, but also including employees that ended up hospitalized or death. So we have to prepare ourselves. We have to put all our ducks in a row in anticipation of a possible lawsuit. Hold on, how come it's not working? Okay, there you go. Last June 15, Governor Newsom opened up the economy. He issued an executive order. So, does it matter? The question is, does it matter in the workplace? The answer is, of course, yes. So, the ETS applies to both public and private entities, regardless of the number of employees. So, whether you are a government agency, federal or state, a private employer, regardless of the industry that you are engaged in, including us, the healthcare industry, ETS applies. I will just use the word ETS. That stands for Emergency Temporary Standards. But however, you have to condition your mind in this particular presentation that this only pertains to employees, not residents. Don't get confused, because your industry or our industry in the healthcare, we have lots of regulations coming from the California Department of Public Health, coming from CDC, that pertains to residents. For now, forget about that. The COVID-19 mitigation protocols that you have, forget for a moment, because this presentation is only exclusively confined to employees. Now, as I've said earlier in my introduction, regulation of the ETS is only temporary. This will be terminated once the public health emergency has been lifted. Now, in the process, I'm pretty sure that you will get confused. There are state laws, there are federal laws. Now, under statutory construction in conflict of laws, which will prevail? Will it be the federal law? Now, I'm talking about in relation to the COVID-19. Or will it be the state law? It's well settled. It is the state law that will prevail over the federal law. So don't use the federal law when it comes to COVID-19 as it relates to your employees, pertaining to masking, using of respirator, social distancing or physical distancing. As to physical barriers, don't use the federal law but use the state law. The question is, what if the state law is conflicting? There are two agencies or three agencies will issue a regulations or a guidance. Which law, state law, are you going to use? So we don't want you to get confused. California OSHA is a state agency, right? So they issued the ETS. The California Department of Public Health is also a state agency, right? And so, which of the two are you going to implement? Now, I'm just talking of employees. The one that you're going to implement is the most restrictive. So, if CDPH, as it pertains to employees, you get an all facilities letter or an AFL, okay, or a guidelines that is more restrictive, that protects the employees in the workplace, that is what you're going to use versus the OSHA ETS. But if the ETS of OSHA is more restrictive than the CDPH rules and regulations, then you have to implement the OSHA ETS. Trust me, my friends, because we have facilities that were subjected to, enforcement. And despite using as a basis the CDPH compliance that we did, we provided all the necessary paperworks. They did not consider that. They still use, the OSHA because theirs is more restrictive. But if CDPH is more restrictive, then we are in compliance. Now, what is the status of the OSHA ETS? Because there was a sea of confusion. Understand that the ETS took effect on November 30, 2020. They were already late in the game. Pandemic started March of 2020, and then they came up the emergency temporary standards only in November 2020. OSHA, we have not seen them. None. They did not participate. All they did was just to enforce the ATD exposure control plan, the respiratory protection program, the enforcement of the personal protective equipment, but they don't have a codified law that we must enforce. They came in late to the game. They came up with the ETS on November 30, 2020. They came up with emergency regulations, of course. They did, right? But they simply adopted what CDPH, what CDC issued. But now, on November 30, 2020, they did. But the problem with this ETS, because there was a sea of confusion, I don't know if you keep track, it is because it does not run parallel to the CDPH regulations or guidance. Okay? As to masking, as to those who are vaccinated, unvaccinated, can they use that indoor or outdoor? Or don't they have to use that one? Including contact tracing, including physical distancing, including physical barrier. So their ETS on November 30 does not run parallel to what CDPH has issued. So what they did, they revised it. The first revision was on June 3 to 2021. But then that revision does not align with CDPH and the executive order issued by Governor Newsom to open up the economy on June 15 of 2021. So what they did, they came up with a second revision. See, it was proposed on June 11. But because Governor Newsom already made a commitment that by June 15, we're going to open up the economy. So what he did, he codified the second revision of ETS in his executive order. So therefore, the ETS, more or less, 90+% of their ETS is in parallel to the CDPH guidelines. Okay? So issued an executive order on June 17, confirming the vote and recommendations of the Occupational Safety and Health Standards Board. Okay? They adopted. But he disregarded the Office of Administrative Law because of the urgency. They cannot wait anymore. Because most of the private employers, we're talking of the service industry, the restaurants, etc., etc. Okay? It runs in conflict with the CDPH. So what they did, Governor Newsom immediately issued an executive order, adopted this ETS. So you can say, therefore, that the ETS, as revised, took effect on June 15 or June 17. Now, so the executive order that was issued by Governor Newsom to open up the economy terminated all executive orders that he issued way back in March of 2020. And what were those executive orders? It pertains to the stay-at-home order and the blueprint for a safer economy. Everything, no more, gone. Because of the vaccination rate that we have, understand that California, fully vaccinated, one dose of vaccine, we are more than 50%. In fact, for one vaccine dosed, we are more than 60%. Fully vaccinated, more than 50%. But because of this Delta variant, Governor Newsom, including the CDPH, now came up with another guidelines. And I don't want to delve into that. I will just stick with the ATS. Okay. So this pertains to conflict of laws. Always remember, don't get confused. And Maribeth always reminds me, and all of you, forget the CDC. Why? CDC is a federal law, a federal government. Okay? CDPH is state. So whatever CDPH issues is the one that will prevail. Okay? And whatever OSHA will issue, California OSHA will issue, that will prevail versus the federal OSHA. But with the ETS, it now aligns with the CDPH. Now, but if there is a conflict between OSHA and CDPH, that which is more restrictive will apply. And we already know, CDPH is more restrictive because employees has to protect not only their co-workers, but as well as, most important, their residents. Okay? So that is how the law works, because I don't want you to get confused in that regard. So what is the ETS? So the purpose of the ETS, of course, is to protect the workers from all forms of hazards. And that is the mandate of Occupational Safety and Health Administration. Took effect on November 20, and it was revised, and it was updated, that will run in parallel to the CDC and CDPH guidelines. So let's not get confused. They are more or less synchronized, albeit with some, a margin of deviation. So the revisions mark a stark movement away from social distancing and physical barriers, and it greatly relaxed the requirement of face coverings for fully vaccinated employees in most settings. And we already know this. Fully vaccinated, indoor, outdoor, but there was a change that took effect this Tuesday, including the testing in the long-term care business that we are in. Okay? Now, what has changed in the ETS? That's what you're going to ask. Issued on November 20, revised second revision on June 17. So we would like to find out what are the changes. So, what has changed? So, fully vaccinated employees without symptoms need not be tested or quarantined after exposure if they are asymptomatic. That runs parallel to the CTPH. But because of the Delta variant, I will not go into that. There are some changes. Kindly refer to that. If that is more restrictive, that is what you're going to apply. They now again reimpose the county tier because it was under the executive order that took effect on June 15. No more county tier. No more physical distancing. Okay? Congregational setting. Okay? On physical, no more. But now, because of the Delta variant, it has changed. But this will just give you a basic. If you are fully vaccinated, this is the advantage. If you don't have symptoms, you don't need to get tested or quarantined. But yesterday, I understand that our employees, whether fully vaccinated or not, twice a week, you have to be vaccinated. Tested rather. Okay? So under the ETS, no social distancing required, except on those two instances, when there is a minor outbreak or major outbreak. A minor outbreak is if there are, 3 or more cases, meaning confirmed positive. And then, must socially distance if it is a major outbreak. A major outbreak is 20 or more cases of confirmed, COVID confirmed, within the last 14 days, within a period of 14 days. So must remember, outbreak under ETS, 3 or more. Okay? Major outbreak, 20 or more. And it has consequences. So major, socially distance. And then, if it is 3 or more only, we only need to evaluate whether to observe social distancing or not. Now, as to face coverings. So then don't get confused with face coverings. It does not pertain to respirator. This pertains to your surgical mask, okay? Or any mask for that matter, okay? So under the ETS, face coverings not required regardless of vaccination status if outdoor. But they recommend face covering outside when employee cannot social distance. If you cannot socially distance. But it is simply a recommendation. So, it's your discretion. If you're outside, okay, whether to wear, that's your discretion. However, we must make face coverings available to vaccinated workers upon request. See? So, if a vaccinated employee will request to have, the surgical mask or any type of mask that is of medical grade, upon the request, readily available, give it to them, even though they are fully vaccinated. As to face coverings, continue. Not required indoors for fully vaccinated employees. We know that, right? After June 15. But there are certain limited exceptions in certain industries. And that industry is the healthcare industry. Okay? So if CDPH say, you have to wear, then we have to wear. Which is, as it stands, we have to wear even though we are fully vaccinated. Green zone, face coverings. Red and yellow, respirators. Okay? That is what I understand. So required indoors for unvaccinated employees. You see? Except when they are alone in a room or in a vehicle or while eating or drinking, if accommodation is required due to medical reasons or infeasible or that it would create a hazard due to the medical condition of that employee. Okay? That is the exception. Otherwise, if they don't fall in this exception, they are required to wear face coverings if they are unvaccinated. And required for all employees in outbreak, whether it's minor, 3 or more, or whether it's major, or more so, major, 20 or more of the employees, the confirmed positive. Continue with the changes in the ATS. Upon request, this is OSHA. You must remember this because if you will be the subject of inspection, they will certainly ask these questions. Upon request, employers must provide unvaccinated employees with approved respirators. We are not talking of face mask here. We're talking of the N95 respirators with voluntary use when working indoors or in a vehicle with others. See? Face mask, of course, they have to wear, right? Unvaccinated. But will they have to wear a respirator if unvaccinated? The answer is not required. But we must provide to them, okay, when they request it, right? But they're going to use it voluntarily. Voluntary is very important. You must understand. Remember your N95 fit testing? If it is voluntary, you don't have to fit test the employee. You don't have to fit test if it's voluntary use. So that's very important. Respirators must be provided to all employees in an outbreak. No request needed. No request. So if you have an outbreak, 3 or more, minor, 20 or more, boom. Respirators must be provided to them. OSHA, in the ETS, you will find the list of vendors that sell N95 respirators. See? Because in the past, we were grappling, we don't know where to buy, we are outbidding each other. But this time, in the ETS, you can find that. One of the appendices, the list. So further, what has changed in the ETS? As to ventilation, of course, we know that our HVAC, the filter must be either HEPA filter, HEPA, or MERV, MERV filters. And it has to be changed on a regular basis. And this all pertains to your life safety code. You must, including OSHPAD. Now, including OSHA. They might perhaps ask regarding your HVAC. So employers under ETS must evaluate the ventilation system to maximize outdoor air, coming in, and increase filtration. So we know the filters to increase filtration. maximize outdoor air. Why? Because if we confine air inside, we don't open up, okay? Then tendency is, if there are viruses that permeates in the air, because we know this is all aerosol, and then we breathe, goes into our nose, then we become transmitters, and worse, we become sick with the virus. Okay? The COVID-19. More so if it's Delta variant. But of course, everything is a matter of adjustment. We are now in a heat wave. The extreme weather that we are experiencing, you cannot just open all the doors and the windows, right? So the trick there, therefore, is the filtration. But to open your doors and windows, no, we can argue that with OSHA. And employers may not retaliate against employees for wearing face coverings, even if not required. You always remember that. It is a form of harassment or discrimination. If an employee, even though vaccinated, if he insists to wear a mask, you cannot retaliate. You cannot say, oh, you're already fully vaccinated, why are you wearing your mask? Cannot do that. But of course, in our industry, it is required. Moreover, now, we're done with face masks, we're done with respirators, we're done with ventilation, let's go to the vaccine. This one is very important. Well, CDPH has these guidelines as well, including CMS, federal. So all vaccination status must be documented. It must be documented. If OSHA will come in your building, the CHSO, they will ask documentation. So there are 3 ways to document an employee's vaccination status. 1, employers will provide you proof, a copy. So we have all of these cards, either issued by Walgreens or CVS. Then, for purpose of documentation, they have the option. Remember, this 3 is an option. So they provide you a copy, you photocopy it, or perhaps they said, I don't need it, you can have it. That is already a proof, but it is a confidential copy. I purposely put here a quotation, confidential. You cannot divulge because this is medical information. This cannot be breached. This cannot be disclosed. Only you can disclose when to a particular agency that requests it, and most likely it will be CDPH. Second, he does not want to provide you a copy of the card. They will simply show it to you. And what you do, you have a document, okay, you just date it. Show the copy, or perhaps you want to put the time and the name, and you saw the validity, the genuineness of the card, that is enough. 3, does not want to provide you a copy. Does not want to show you a copy. The employee can self-attest in writing. He will just say, I, Joey Tugong, hereby affirm that I took my vaccine on this date, etc., etc. That is enough. And you keep that. And all of these are considered to be confidential. So you cannot force an employee, hey, you better give your card. You better show me your card. The employee will simply say, no, I will just attest in writing. So this is the way to document their vaccination status. If the employee refuses to provide proof, assuming you have an employee, we say, no, I don't want to, tell you whether I am vaccinated or not. My friends, under the ETS, they are not required to do so. But I understand CDPH guidelines, you are required, right? So that is more restrictive, right? So we apply that. But OSHA, it is not required if they refuse to provide any one of those 3. And if they refuse to provide you the proof, you must treat that employee as unvaccinated. And you already know the ramifications if you are unvaccinated, right? In terms of the face mask, indoor and outdoor, in terms of physical distancing. See? And if they refuse to provide proof, you cannot retaliate or discriminate. So in other words, you cannot call him in, hey, you know what? You refuse to provide information or proof, I'm going to write you up for insubordination. Cannot do that. You have to respect his right not to divulge the information, but you can now consider him as an unvaccinated person. What has that changed? So everything that I discussed with you, those are the changes under the ETS. Okay? Digressing from the November 20. And that has been codified with Governor Newsom's executive order. So what has that changed? Employer must still provide COVID-19 training. Employer must still maintain a written COVID-19 prevention program. 101%, most of you does not have the CPP. You don't have it. I know two of the facilities because we were subjected to the inspection. And so what I did, I provided it to them. But don't worry, I am going to give it to you. And this is part of the seminar that we have. I will discuss briefly. So this will just show you, the Model COVID-19 Prevention Program or CPP. Okay? For those Filipinos, CPP stands for Communist Party of the Philippines. But this one pertains to COVID-19 prevention program. Employers must still do contact tracing. Of course, that's part of the CDPH guidelines. Nothing changed. Employers still must notify employees of exposure. Of course, that is very necessary. That's part of the contact tracing if you have one employee that is confirmed or perhaps has symptoms, not only co-workers but including residents. We will still continue on doing that. You see, it runs parallel to the CDPH. And same thing, runs parallel. Employers still must notify Public Health Department of outbreaks. See? The same. Employers still must notify OSHA of serious illness, death in the workplace. But it does not state here that every time we have outbreak or every time we have confirmed cases, we are not required to report to OSHA. No. We will only report to OSHA if there is serious injury or illness. And by definition, we already know that. If the employee was hospitalized, not for observation, but for treatment for more than 24 hours, and we have to report it to them within 8 hours upon knowledge by any of the management. And Elizabeth and I were working on it because we have a facility that we reported. And trust me, 100%, if we report, they will come into the building and they will have a laundry list from A to Z. What are the documents that you have to provide? And then shortly thereafter, you will get a citation of notification of penalty. They will always find ways to ding you because they need money. California is not running out of money. We have, excess money. In fact, we are giving money, the state of California. But they still need more money. But most important is, perhaps, this certified health and safety inspector would like to impress their supervisor that they are good. See? So almost always, they will issue a citation. Employers must follow all quarantine exclusion pay requirements. And we all know that, same as CDPH. Continue. Employers still must offer testing at no cost during paid work time. See? Same as CDPH. Symptomatic employees, of course, if symptomatic, boom, we must, conduct testing. Unvaccinated employees after exposure. We know that. Vaccinated employees after exposure if they develop symptoms, right? If no symptoms, remember, no testing, no quarantine. Right? But again, because of the Delta variant, things have changed. Unvaccinated employees in an outbreak, 3 or more cases, the minor, all of them, we are going to test them. Must offer testing. But if there is an outbreak, 20 or more, all, whether vaccinated or unvaccinated, CDPH guideline is not only offered, required to undergo testing. So you see the minimum threshold of ETS. So where it is restrictive, which we know CDPH, that is what you are going to implement. Now, what do I do if my employee is positive for COVID-19? Of course, we already know. They must be quarantined for 10 days regardless of vaccination status. And then, they can return to work. This is just basically just a review. After 10 days have passed, the employee symptoms have improved, and during the last 24 hours before the 10th day, they are fever-free without using fever-reducing medication. Do they have to get tested again? The answer is no. After 10 days, terminate, back to work. Continue. Exposure requires direct contact. You see? So you cannot just say, well, you know what? He was with this confirmed positive employee immediately. Okay? They work in the same shift. They work in the same office or office space. Automatically exposed. You have to be quarantined, my friends. You have to conduct contact tracing. You see? And contact tracing, you already know. And one of them, 15 minutes of contact over 24 hours. In the past, it should be uninterrupted, right? 15 minutes within 6 feet, then you are in direct contact, whether you're wearing a mask or not. But the new direct contact, there is a ramification. It could be 5 minutes within 6 feet, and then in the parking lot, another 5 minutes, and then in the break room, perhaps another cumulative, provided it is within 24 hours, your interaction with this confirmed employee, then you fall under the direct contact, you were exposed, go home. Stay there for 10 days. Unvaccinated exposed employees, mandatory OSHA quarantine for 10 days. Vaccinated exposed employees, no quarantine unless the exposed employee has symptoms. So we already know the advantage of those who are vaccinated. But my friends, ladies and gentlemen, because of the Delta variant, CDPH came up with the new guidelines in this regard. Okay? Can you still test your employees? Again, my friend, always call OSHA. Forget about the CDPH, okay? Testing is permitted but has limited value. Okay? So in other words, a private employer not related with the healthcare industry, okay, they are not required. Okay? It's permitted but has limited value accordingly. Employer must pay the required test but not for voluntary tests. See? So in other words, everything is being paid by the employer. But if the employee will approach you, well, you know what, I want to get tested voluntarily, okay, we will charge you, okay? Employer may not require a negative test before an employee can return to work. See? You may not require. May not. But can you require? Under OSHA, yes, you can. But normally, we don't do that, right? If you're done with your 10 days, symptoms free, then you can return without any testing. Should I still screen my employees? See, this is very important. You see, OSHA states to the effect, it is still permissible but not required. Not required. But which is more restrictive? CDPH says, continue with your screening protocol. So therefore, we will adopt CDPH, right? But OSHA, it is only permissible. Symptom surveys are still permissible but not required. See? What do you mean by symptom survey? ICP, perhaps conduct surveys in the building. Those who any symptoms, whether workers or residents, okay, and then if they found out that they have symptoms of the COVID, then they trigger their contact tracing and the COVID testing. But in other employers other than the healthcare industry, not required, only permissible. Update your mandatory COVID-19 prevention plan if you make changes to these procedures. So therefore, since we are with CDPH, then you must update this one, okay? That you're still required, they're still doing your, screening protocols, and you still do your symptom surveys. It must be incorporated in the CPP. Moving forward. My friends, we're going to have a break at 11, okay? 10 minutes. What kind of training do we have to provide? See, remember, we have to provide COVID-19 training. I'll tell you, we ended up with a citation because even though we have the policies and procedures in place, but we failed to train the employees. When we say trained employees, then it must be properly documented. It must be communicated to them. Remember hazard communication that is incorporated in your INIPP? That is also included in the CPP. You have to communicate and educate because it's very tricky. When they come into the building, they will randomly approach employees. And I'm sure you're here. One of them is listening to me because we were both in this situation. Do you know what is an injury and illness prevention program? They asked the employee along the whole way. He said no. What is that? Now, would you imagine? Now, we ended up with a citation in that regard. You see? Do you know what is an ATD exposure control plan? No, we are not aware. What is that? So, if this sounds alien or foreign to your employees, you will end up with a citation. So, it's very important that when you roll out, which I'm going to send it to you tomorrow, the CPP model program and the IPP, okay, which I'm going to explain later, you must train and educate your employees properly documented. It must be in their brain what a CPP is, what is an IPP. Because, OSHA, if they'll ask the question, if they say, well, what is that? You will end up with a citation. Okay? So, the information and training, see, policies and procedures of COVID-19 safety protocols, etc., etc. We already know that, right? The COVID-19 symptoms and the need to check for them. And, most important, the rights and benefits related to COVID-19. See, like the CSPSL benefits, like the exclusionary pay, okay, like their paid sick leave, like their vacation benefits. They can avail that, my friends, ladies and gentlemen, including their protection while they are out on leave. Worse, if they have medical serious health condition, under FMLA, under CIFRA, we have to educate them, okay? And remember, the CSPSL benefits, it must be posted, okay? Because that is required under the law, SB 95. Do I have to provide PPE? Okay? This is, again, OSHA. The word is must. You have to provide unvaccinated employees with face coverings that cover the nose and mouth or reimburse employees for the cost. You see the word here? Reimburse employees for the cost. So if you don't provide to unvaccinated employees, then if they purchase it on their own, then we have to reimburse them. But of course, I know we have a lot of surgical masks. Make face coverings available to vaccinated employees upon request. You see? Because we know, other than the healthcare industry, if you're vaccinated, indoor or outdoor, no need. Right? But if they request, here, provide them. Must be made readily available. Face coverings in public transit, K-12 educational facilities, healthcare and long-term care, and these detention and shelters, they must use face covering. See the word? Healthcare and long-term care. You see? OSHA is also smart. They do understand the exception because of our industry. We are number one. The healthcare industry, most of the confirmed cases, most of the deaths, most of those that hospitalized, we know that belongs to the healthcare industry. But the irony of it is, most of those that are vaccinated are the residents 65 years older and above. In the healthcare industry, our employees, you know what is the trend? Around 50% of the employees, I'm talking of the nation, refuse to get vaccinated. So what we have now is the pandemic of the unvaccinated. Those who are vaccinated, worry-free. Pfizer, Moderna, Johnson, it works. This is a public health issue. This is not a political issue. You have to tell your unvaccinated employees. The Delta variant is the worst. Before the Delta variant, we have the UK variant, the Alpha variant, the South African, the Beta variant. Before. If you notice, those 12 years under, those young people, they did not get the COVID because perhaps of their immune system. But with the Delta variant, don't you know, hospitalization now, most of them are younger people and those under 12 years old. This is how potent, how lethal, how extremely contagious, fast transmissible the Delta variant is. So if you are unvaccinated, my friends, chances are more than 90% you will get infected and more than 90% you are going to die. Okay? Kindly send that message to your family members, to your friends, to your co-workers who refuse to take the vaccine. See? But nonetheless, if we are vaccinated, see, we still have to wear the PPE. And we know that. Okay? Now, what is the COVID-19 prevention plan? Now we are going to go into this. Okay? This one is not permanent. This is simply temporary. Once the pandemic has ended, done. They are not going to request you. But once there will be again a COVID, hopefully there will be not, then this will become relevant again. So this is what you call emergency temporary standards, and it is under the California Code of Regulations. And so we don't have to worry about it. Where are we going to get it? My friends, Elma, Elizabeth, and we did not work on this. This is a model template. It came from the Department of Industrial Relations. I pulled it out. We pulled it out. So it's very easy. What you do, you will just fill it up. See? All of this here, the red color, just fill in. But I already filled up. So what I'm going to do, I will fill it up for you. But you will just change the name. Okay? So I make it easy for you. So this was provided, this model program, in order to assist employers with creating their own unique CPP, tailored to your workplace. Now, continue. Employers may create your own program. So if you say, no, I don't want the CPP coming from this Department of Industrial Relations, I will do my own. Well, good for you. Thank you so much. You can create your own. Now, but when you create the CPP, you can also incorporate some of these elements into your existing injury and illness prevention program. Remember the INIPP, we had this way back since the early 20s. I rolled it out. And I remember I was new in this company. It was June Hernandez who held my hands. And the first training that we did for the INIPP, it was in Cherry Valley Healthcare. We didn't have yet this PowerPoint. No PowerPoint. We were using this what do you call this, Elma? The laminate, yeah, and then magnifying. That's what we're using. I can picture myself in Cherry Valley with June Hernandez when we rolled out the INIPP. But the problem with the INPP, because of the turnover from DSD perhaps and administrators, they were lost. So we are going to reintroduce this again. But this INIPP has something to do with the COVID. Your INPP that you currently have, please do not throw it because that will continue forever and ever. The one that we are going to share with you has something to do with the COVID. It's only 10 pages. Where is it? Okay. Here. It's only 10 pages. The original INIPP, which you must have, I would say it's more than 30 plus or more than 40 plus pages. But still, you must. Okay? Have that in place. Okay? So must be written. Of course, all of must be written. And you see here the last. It must be provided to employees. Again, I'll tell you, we end up with a citation. Employees were asked, do you know what is an IPP? Oh, what is that? See, you must train and educate. And when you train and educate, it must be properly documented. So these are the elements required in a CPP. Just like the IPP who has the authority and the responsibility to implement the INIPP. Not only to implement, but including to enforce compliance by everyone in the workplace. And it must be in both of these documents. And then you have to identify and evaluate COVID-19 hazards in the workplace. And in that evaluation and identification, there must be employee participation. See? So everything is here. I'm just giving you the elements incorporated in here. See? Correction of COVID-19 hazards. How are you going to prevent? Do you have administrative controls? The PPEs? Do you have the engineering controls, etc., etc.? Control of COVID-19 hazards. And we know that all of these, face coverings, engineering controls, the cleaning and disinfecting, the high touch, the low touch surfaces, the hand sanitizing, the PPE, testing of symptomatic employees must be in here. Anyway, it's already in here. It's just a matter of, there are certain parts there that you have to add. Continue with the CPP. Investigating and responding to COVID-19 cases. There is a provision. Now, if I were you, CDPH, whatever you have in your COVID-19 mitigation, incorporate just even one sentence, 2 sentences. You can just say, refer to COVID-19 mitigation protocols, which was approved by CDP. Simple like that. You don't have to, follow what's copy in toto. In toto means word for word from that COVID-19 mitigation. No need. System for communicating. How do you communicate when there is exposure, when there is confirmed cases? And of course, including also regarding the program that we have, training and instruction. Exclusion of COVID-19 cases employees who had close contact. We're talking of isolation and quarantine. Under what circumstances are you going to do? It must be there. And most important, reporting. Of course, the requirement, we have to report this to CDPH, right? And of course, to call OSHA under certain circumstances if it is a serious injury or illness. Record keeping and access. Access means the privacy, confidentiality of these records. No one can just easily have access to these documents. And of course, return to work criteria. And we already know that, right? After 10 days, no symptoms, then you end. Now, let me just finish this INIPP, then we are going to have a 10 minutes break. So, due to the COVID-19, do I have to modify your injury illness prevention program? My friends, I already talked to you because the original INIPP that you have has nothing to do with the COVID-19. It only pertains to mechanical injury in the workplace. The slip, trip, and fall, the back pain, the upper back pain, all of this. You call this mechanical injury. That is what cover where you will have a safety committee, you have your trending analysis, you conduct your corrective action. That is what it pertains to the original INIPP. But the one that we are going to share with you, my friends, has something to do with the COVID. Okay? So, this is a standalone. So, you must have it in place. Because the original INIPP, if OSHA will come in, and you're, oh yes, we have an IPP, they will just throw it in the wastebasket. Why? Because it does not incorporate the COVID-19 hazard. Remember, COVID-19 is a hazard. It is a biological hazard. Biological hazard. You see? Because the mandate of OSHA for all employers is to see to it that all employees are free from any exposure to hazards. It pertains to their safety and health. So we can do that. Okay, we have to modify. And then we must again, share this to our employees. So these are the elements of this new INIPP. So as you know, under California law, employers must establish and implement and maintain an IPP to protect employees from hazardous workplace conditions. And again, it must be accessible to employees. Not only training for them to know, because if OSHA will come in, do you know what a CPP is? Do you know what an ETS is? You know what an IPP? If they say yes, good, we'll clap our hands. The second question is, do you know where it is located? That is the next question. And we ended up with a citation. Do you know where it is? This pertains to accessible to employees, my friends. So they must know. So that's part of the hazard communication in your training. Hey guys, DSD after training, you can find the CPP and the IMPP in all the nurses station or in the DSD's office or in the administrator's office. Do not just have one repository. Okay? It must be available in 2 or 3 places. That is accessible. So if they will ask, the employee will say, well, you know what? Yeah, we have it in the nurses station. It is accessible. Or perhaps you can put there, like a poster, okay? CPP and IPP here. See? It is there. And perhaps you want it color-coded. Perhaps it's red or orange or green. See? So these are the following provisions under the modified IPP. Procedures for creating safe and health work practices. Procedure for So you just go all of this. This is just part of the original, but you're going to incorporate the COVID-19. But don't worry, my friends. We already laid it out here, okay? Employee training is very important, okay? Regarding this matter, okay? So now, we are going to have a 10 minutes break, my friends, ladies and gentlemen. And after 10 minutes, we'll resume. I'm going to show you here, where is this? Another I'll do. Yeah, you can proceed now with your 10 minutes, but I have this PowerPoint 10 minutes. When all the blue will turn into white, meaning 10 minutes is done. Okay? We'll have a 10 minutes break.